the Motiva Round. See, this one really maintains its shape. I love this because people that get breast augmentations want that shape. They want the fullness up top, especially if I'm doing a lift at the same time. They really want that fullness up top. Let's take a deep dive into the world of breast implants because, the United States is a little different than the rest of the world, and our FDA approves things as they want. Now, there have been 4 different manufacturers that we've been using on the market for the past 10 or so years. The reason we're talking about breast implants today is because a new one just got approved, and I'm very excited about it. And I'm going to talk to you about all of the different breast implants, okay? Meaning that I'm not just going to stick with just the new one, but I'm going to talk to you about all of them, just like I talk to you if you're a patient sitting there ready to get a breast augmentation. And this is basically how my consultation goes. If you're coming in for a breast augmentation, you come and have a chat with me, and I talk to you about 3 important things you need to know. First thing I always talk about is the selection of breast implants. And why is that so important? Is because you're having a device put into your body. And what kinds of breast implants are there? Why do we use them? What makes one better than the other? And what do I like the most? And here we go. And I'll talk to you about them all. The other 2 important things are incision and location of implant position. I'll talk to you that perhaps on a different podcast or at the end of this podcast. But let's take a deep dive into all these breast implants and why we even want to talk about them. So the different manufacturers follows: Mentor, Allergan, Sientra, Ideal, and the new one, Motiva. They all make silicone implants, and some of them also make saline implants. And what's the difference? So we're going to start out with this. Saline versus silicone. Saline is this bag filled with salt water. Normally feels firmer because we have to overfill it. Normally feels faker and looks faker and doesn't have the feel of a breast implant. How often do I put a saline implant in? Very, very rarely, and only if a patient really asks for it. Because in my opinion, their downsides to saline implants are they ripple more over time. They evaporate over time, 1% a year. So if you imagine 300 cc's in 10 years is 30 cc's less. That's why we overfill them. And in my opinion, you're really kind of setting yourself up for an implant change sooner than you think. So I'm not going to really talk about saline implants today. I'm only going to talk about silicone because I feel like that's really the standard of care these days. That's what we use for most of our patients. The majority of them, I'd say probably in this practice, 95% and up. Most of the time, saline implants are used mostly due to cost because they're significantly less expensive. Now, let's get into Mentor. Mentor implants. There are 3 different types of implants. I talked to you about the memory gel and saline and the memory shape, which I really don't use because this is the memory shape. It's a teardrop implant that's got texturing on it. I don't like to use textured implants. The Allergan textured implant has been taken off the market due to the fact of something called ALCL, which is a rare type of lymphoma that has been linked to this type of texturing. It's a salt-based texture that's done by Allergan, so we don't really use these, okay? Or Nitrel, which is the same name, but these are what are called anatomic or teardrop-shaped implants, and in all reality, I don't use these either, but I just wanted to show you. For Mentor, they do have 2 different implants. One is their regular memory gel, and the other one is their boost. And this is the one that I like to use. It is a little bit more filled. It's very, very soft, gives a really nice look to it. The pros, listen, they've been around forever. I used Mentor when I was in training and I started out using Mentor. This is their cohesive gel, so their gummy bear, so it holds its position. They have a really, really good range of sizes and profiles, probably more than anyone, and really kind of meets different body shapes and goals. And the warranty is wonderful because it offers a lifetime product replacement for rupture, and they have about a 1% rupture rate, and a 10-year financial assistance for capsular contracture for $3,500 to the patient. Now, what are the cons? The cons is, Their texture, only limited availability, and really I wouldn't do it. And their saline implants are very, very stiff. Now, I'm going to talk about little studies that each company does, just so you understand some evidence-based medicine behind this. Clinical data supports a very, very low rupture rate with very high patient satisfaction. And the safety study shows that 1% rupture in these. A lot of people worry about that. We do surveillance at 4 to 5 years with ultrasounds to make sure there's no ruptures. But Mentor, great product, very soft. But if you look, there's still a little bit of rippling to it, right? So the other ones have a lot of rippling to it. The memory, the boosts, if you're going to go with Mentor, I would go with a boost implant. Moving along to Allergan or Nitrel. Now, they're by far the largest aesthetic company in America. They make Botox and they also make a Juvederm, but they make implants, and I use them a lot. I use them a lot for reconstruction because Cedars-Sinai carries them, and I do my breast cancer reconstruction there. I really do like these implants. They have basically 3 types, not including the saline. They have a reactive, a soft touch, and a cohesive. So reactive has the most liquidy gel. Soft touch is a little less, and the cohesive is a fully cohesive implant. So when you look at these 2 different implants, this is a soft touch. You see how it kind of ripples? It's a little bit softer. And this is a fully cohesive implant. Holds its form much better. I tend to use more cohesive implants than I do anything else because I like to have that upper pole and cleavage really keep its position. And most people that do this procedure want that fullness up top and they want that cleavage. It also really works well for people that are very skinny and ripple because look at the rippling is very, very little. I love these implants. They're cohesive implants. I use them a lot. The nice part is about this company is they have 5 different projections. They have low, low plus, moderate, high, and high plus. So they're different projections for different body shapes and size and different desires. Softness, like I said, there are 3 different feels to it. So versus the reactive, soft touch, or the cohesive, I tend to go with cohesive for almost everyone. Obviously, this is the most expensive because I find it to be the best. Now, warranty, the same thing, 10-year financial assistance, up to $3,500, and lifetime implant replacement for rupture. The cons, what is wrong with Nitrel? The only thing that's really wrong is this implant. It's been recalled. So if you do have these textured implants, get rid of them. Most doctors will do this for you, and the company will literally replace this for free. Very low incidence, but there is a small number of people that have had something called ALCL, and it's a lymphoma that's very rare, but it has been very much linked to this texturing. Also, I'm not a fan of textured implants that are shaped because imagine if this moves, your breast looks really strange. So I like round implants because if round implants move, they keep their shape. And I do want them to move because we want the implant to move just like it's your body. The other con behind it is these are a little bit more expensive, especially the highly cohesive ones. Studies, I'll tell you, they have a lot of studies. Long-term stability shows very high stability with the shape, very low rupture rates, and very, very, very high satisfaction rates with these implants. Moving along to Sientra. And Sientra probably has been around for less than the other brands. I've used them. Their big difference, now they have the same type of silicone, highly cohesive. They do have an HSC and an HSC plus silicone gel. The plus is a little more cohesive. It's kind of like the soft touch and the cohesive for the Allergan. It does feel great. It's soft. The pros and the cons, I would say their 5-year data, less than a 2% rupture rate, and their warranty is probably their biggest selling point. 20-year warranty that includes financial assistance for rupture and capsular contracture up to $5,000. So they have the longest standing warranty. The problem is they're the smallest company. They were just bought out by Tiger Aesthetics, and I think they're going to be a stronger company. The cons for a while were that these can only be placed by board certified plastic surgeons. Well, I think that's a good thing because you don't want anyone just putting them in. So they only sold to board certified plastic surgeons. I use them. It's in my armamentarium. It is not my go-to, especially now that there's Motiva, but it's pretty good. And their studies show, 5-year study, less than 1.8% capsular contracture rate. Excellent. It's lower than the industry norm, which is up to 10%. And the high strength cohesive gel has a really nice way of keeping that upper pole nice and tight. Now let's move on to the latest and the greatest in implants. And these are the Motiva implants. If you look on my desk right now, they all look the same except for these two, other than the two textured that we don't really use. So let's get rid of them. So, Motiva implants, they're blue on the outside. They're really cool. When I say new, it doesn't mean that they're new in the world. It just means they're new in the US. They've been around for almost 20 years in Asia and in Europe, and they're the #1 implant that's used in Korea. And we know Korea is just really crushing it when it comes to aesthetics. So I really did a deep dive and I wanted to use these. So I've been using them now since they came out. I'm probably the #1 user of it in Beverly Hills. The company's loving me. But this is why. This is why I like them. So they're 2 different implants. So let's put these aside. They're 2 different implants. They have a ergonomics, which is more of a natural breast where when you pull it up, it has a little bit of a ripple, but it maintains a teardrop shape. And the Motiva round. See, this one really maintains its shape. I love this because people that get breast augmentations want that shape. They want the fullness up top, especially if I'm doing a lift at the same time. They really want that fullness up top. So really, they're available in what's called the Silk Surface Nano Texture Smooth and Smooth Silk. Now, pros. And what's so great about this implant? Natural movement. They don't induce a ton of inflammation. And that's the cool part. You don't get capsular contracture. They have the lowest capsular contracture rate, reduced rate for ALCL, which was with the textured implants. They say it's almost non-existent, and they have a great warranty as well. What are the cons? Well, it just got FDA approved, and people don't ever want to be the first ones to do anything. They've been putting them in Europe and in Korea forever. And what are the studies? And what are they so great? And I really want to do a deep dive in on this. So, these Motiva implants have gained significant attention as a next generation option for cosmetic breast augmentation. They're still not available for use for reconstruction in the hospitals, but their advanced technology and innovative features are the reason why I find these to be a step above and better than the others. Now, so this is the interesting part. The reason why I find it to be so great is they've got a natural look and feel. This ergonomics technology that I showed you for this allows the implant to mimic the natural breast tissue movement, providing a softer, more natural shape. These implants adjusted based on body position, standing versus lying down, enhancing a realistic appearance compared to traditional implants that remain fixed. These tend to move with your body, which I love. Now, what's even better and what's going to be the biggest selling point of these implants is reduced capsular contracture. So what's capsular contracture? If you don't know, you can refer back to one of our podcasts where I spoke about it. It's just scar tissue around a breast implant. All breast implants, or all foreign bodies that are placed in our body, have a little bit of scar tissue that forms around them. This becomes scar tissue that becomes hardened and uncomfortable and painful over time. So, the difference with this is they utilize a silk surface and a velvet surface technology, which are smoother and less abrasive compared to traditional textured implants. This design lowers the risk of capsular contracture and reduces the chance of ALCL. That's one of the other important things. They're literally tiny, tiny microscopic pores that are put in here that you can't see. Now, thanks to their superior elasticity and true monoblock shell design, you can also use smaller incisions to put these in. And here's another cool feature. Why are they blue? Well, the reason they're blue is so it provides a visual assurance that the implant shell is intact during surgery and there's nothing leaking. So you can actually see it. And it helps minimize the risk of silicone gel leakage or implant rupture over time. Lastly, or actually two other things. Motiva, they integrate technology like 3D imaging through the Motiva Imagine platform, which we use here, and I use the Vectra as well, to show the exact implant inside your breast so you can see what it looks like. And then the microstructure shell strikes a balance by reducing risk while maintaining stability and a natural integration into tissue. There's a couple of other really cool things that I thought, really sets them apart. So, for years and years and years, one of the most difficult things is finding out the size of someone's breast implants that have been put in years ago. Well, interestingly enough, the Motiva QID technology, offers a radiofrequency identification chip embedded within its implant. So this chip will allow surgeons or patients to scan the patient with a handheld device to assess clinical information such as implant size, implant shape, implant profile. It does not track the patient. There's no GPS in here, if that's what you want to put in. But it does really kind of give you an idea, because I've operated on people that have had implants 30 years ago and they have no idea how big it is. So this has that chip that you can tell. And it also is essential to detect ruptures as well. However, MRIs and ultrasounds are still the best way. I'm a big fan of this implant because look at the amount of rippling it has. Almost none. And when you look at projection amongst all of these, they really give you a really nice projection. I've been using these probably for the last month, and I have had everyone is very, very happy. Now, some of the patients I've actually taken older Mentor implants out and I put these in. And look at the difference. I mean, it's a huge difference. So I'm not trying to kill Mentor's business. The boost is better. But look, even with the boost, I feel like this new implant really maintains its shape beautifully and a lot better than, and here's the Allergan. So I think these two probably maintain their shapes the best. Now, again, not everybody has these implants. I think you have to go to somebody who does a ton of breast augmentation, which I do. And really, the way I like doing my consultations is bringing all these implants and have you feel all of them. I'll give you my recommendations. But again, remember, you're here and you get to pick your own journey. I use all of them. They're not interchangeable, I don't think. I think each one has its pros and its cons. If I could tell you one implant that I think so far is superior, I'd probably go with the Motiva implant. But again, everyone has a different aesthetic goal and is going to want a different feel. Some people may think that this Motiva implant's a little too tight or too firm. I do believe that if you put these under the muscle, realistically, they feel the same as all the other ones. So if you're looking for a breast augmentation, if you're really thin, if you don't want that rippling on the lateral aspect, Motiva is great. I know that it's not all around the country yet. It's taking some time to get out there, but ask your plastic surgeons, see if they can get it. I think it'll be in your area sooner than later. I'm a big fan. I think that it's kind of raise the bar just enough for all the other manufacturers to come the same. And anytime you come out with a complication rate that has 20 years ago was 20 to 25%, it's gone down to about 10 to 15%. And now they're telling us 1%. Well, I'm going to go with the one that's 1% because I'll tell you, if you come and have an aesthetic procedure and have capsular contracture, you're not going to be happy. So if I can take my capsular contracture rate down even lower than it already is, why wouldn't I?
If you like this video, you're going to love this one.
We're going to talk about what Allure, the magazine, thinks the biggest plastic surgery trends of 2025 are going to be.